Hi everybody, Dr. Rob DiMartino here in Henderson, Nevada, just outside of Las Vegas. And we wanted to take some time to make you this video today to talk about reflex sympathetic dystrophy. We're going to talk about some of the causes, we're going to talk about some of the neurology that goes underneath the surface, and what we can do about this really debilitating disease on a way of getting it rehabilitated as much as we possibly can, or sometimes even into full remission. So if you're watching this video, unfortunately you're probably dealing with this condition and you're aware that it'll typically start with some sort of injury. It can be something fairly minor like a sprained ankle to something fairly major like a car accident or after a surgery. But it can spiral out of control very quickly and become very, very debilitating, very, very painful, and obviously start to affect your life in a very profound way. So when we talk about reflex sympathetic dystrophy and the treatments that have to happen, we really majorly cover 4 areas. And the first thing starts with the actual name itself. The S in RSD, Reflex Sympathetic Dystrophy, stands for sympathetics, which is a specific part of your nervous system that most people will talk about as far as fight or flight. And that fight or flight reaction causes some sort of a problem that will change the body's reaction to the way it feels pain. And it changes the body's reaction to think that it's in crisis all of the time. The problem with sympathetics, and we've known this for years, and obviously it's involved in the name, the technology to measure how much in sympathetic dominance a person is has been around for decades. The problem was there was never any way to directly treat it. Any kind of treatment modality we had, whether it be massage therapy or physical therapy or chiropractic or acupuncture, down the line to nutrition or even exercise, all of those things indirectly affect sympathetics. Now, within the last 5 years, we've had a huge major breakthrough in neurology, and they've created a treatment technique that actually works that will directly affect the sympathetic nervous system. To my knowledge, it's the only treatment out there that directly controls sympathetic dominance. It's an absolute imperative that this happens for the loop of RSD to be able to be broken. Now, beyond that, we can start to have problems with peripheral nerves. Those are nerves that are away from the spinal cord, away from the brain, that are in your legs or in your arms or in an extremity where the RSD may be. And sometimes we have to rehabilitate those nerves as well. Again, within the last 5 or 10 years, advanced treatments have come along that are non-invasive, drug-free. All of these treatments are non-invasive, drug-free, that are designed to rehabilitate these nerves. The same way that somebody with a physical injury to a muscle has to rehabilitate the function of that muscle, we have to rehabilitate the function of that nerve. And in this case scenario, it has to be able to feel pain normally and actually be able to integrate what kind of sensory it's feeling. This is not numbing the nerve. This is not confusing the nerve into not feeling pain. It's teaching the nerve how to feel normally again like it did before. Nothing is going to band-aid this kind of pain. We need to reintegrate that sensory. The other portions obviously that we deal with, and while I don't like the term chemical imbalance because I feel it has a negative connotation, it is something that most people understand. And chemical imbalance has to do with the way that the brain signals chemically. And it's how the brain feels and senses pain. In RSD, it's on a way higher level than what it should be. This is what doctors most of the time give antidepressants for, even though it never fixes the cause of the problem and actually can, in the long term, create the problem to get worse. Using natural supplements designed, knowing more about brain chemistry now than we ever have, this is something that can be handled. And then obviously the last part is what we call neurogenic inflammation, the big 10-cent word. And what it means is inflammation that's caused directly by a nerve problem. And the problem again with this is most of the medications they give don't handle neurogenic inflammation. It just handles regular inflammation. Specific things that can be done to handle neurogenic inflammation. You handle these 4 things, we've seen profound effects on the way people's RSD affects them, the way that the pain levels start to move down, and the greatest thing of all is the way that this can be tested is going to show a person a change. When we do the sympathetic testing, almost immediately, about 60% of the people we work with will feel a change right then and there on the table. It's a powerful thing for us as doctors to know on a certainty level that this person's going to respond to our type of treatment, but on the flip side, it's a powerful thing for you as a patient or a loved one helping out a patient to see them change and know deep down inside that there can be some help on the other side of the fence. So again, Dr. Rob DiMartino trying to find a cure for RSD.